Hello, I'm Dr. Moleski. Welcome to our video series. Today I'm going to talk to you about functional medicine and functional neurology and how they relate to chronic conditions. These are conditions like chronic fatigue, acid reflux, brain fog, insomnia. Well, let me tell you about me. I'm a chiropractic physician. I graduated in 1979, and I've seen thousands and thousands of patients over the years with chronic conditions like yours. Over those years, I've attended thousands of postdoctorate education hours, and I've been trained in functional medicine and functional neurology. I'm a graduate of the Functional Neurology Institute, and I'm board certified in integrative medicine. I want to talk to you a little bit about chiropractic. A lot of people ask me, why is a chiropractor talking to me about this? Most people don't know it, but chiropractic is the largest natural health professions in the world. I come from a very medical background. My mother was an RN, and my grandfather was a pediatrician. And so everything we looked like was, all my life, was mainline medical care. And so I was in high school, I graduated when I was in med school, wanted to be a medical doctor. And at that time, my sister developed very bad migraine headaches. I mean, she was just out of commission. I mean, she was 3 days a week. She was throwing up. She was in a room with all the lights out. She was in terrible shape, and she tried all kinds of drugs and medications. I was asking my professors and seeing if they gave me any ideas to help her, and nothing. One of her friends suggested she go to a chiropractor. And I thought, a chiropractor? Why would you go to a chiropractor for a migraine headache? Well, she went, and her headaches went away. What he did to her, and he looked at her diet, looked at her nerve system, and she got better. And this chiropractor gave talks about what chiropractic was, and I went and sat and listened to him. And he came with an amazing story, which I never really thought about before. And he talked about how the human body is this amazing creation that knows how to heal itself, and that it's a body by God, and that if you set the stage right, the body can heal itself so well. It's not necessarily suffering from an excess of organs or a lack of drugs. It's a different mindset, a different philosophy of healthcare. And now, medical care has its place in an acute situation, but overall, the body is amazing how it can heal. If you can keep the body functioning right, you can live a very, very healthy life a long time. So, what goes wrong? Everything's about function. Your body needs to function right. If it doesn't function right, you will be ill. You'll have symptoms. You won't feel well. And what happens? We get stressed. We have stresses in our lives. We've got mental stress, physical stress, emotional stress. A big part of our stress in America today is what we call our S.A.D diet, the standard American diet. I mean, the standard American diet is horrible. We eat packaged foods that, they have a shelf life of a year or 5 years. I mean, there's no nutrient value in our food. Our foods are genetically modified. They're hybrids. The soils are depleted. I mean, you're not going to get a mineral unless it's in the soil. And when they don't fertilize those minerals back into the soil, it won't be in the plant. So like a pound of spinach today has tremendously less iron in it than a pound of spinach did 40 years ago. There's pesticides and herbicides in our environment. We eat too many prepared foods. We don't eat enough protein. We eat for psychological reasons. And again, we're so stressed, we just eat too much food. The average American is overweight. So let's talk about this malfunction. The body was meant to work right. When it doesn't work right, it malfunctions. And when it malfunctions, it's natural for it to give you a symptom. And it's the body's way of telling you there's something wrong. And in America, when you get a symptom, you get a prescription. So here's what unfolds. Let's say your body's not working right, and all of a sudden this gives you headaches. And you go to your doctor, you describe these headaches, the nausea, the sensitivity to light and whatnot, and he says, sounds like migraines. We have all kinds of drugs for that. We got Percocet, Imitrex. We're even given Botox injections for that. So he gives you the medication, hopefully helps your headache. But if you notice, it never did anything to address the cause of the headache in the first place. So there's still, your body's malfunctioning. And when it malfunctions in one gear and it's not working right, it's going to give you another symptom. Maybe 6 months, a year, 2 years later, another symptom. Let's say you get acid reflux. You go to your doctor, you tell, oh, my gut hurts, I get bloated, I get gassy. He says, sounds like acid reflux, and well, we have all kinds of drugs for that. We got Nexium, Protonix, Prilosec. Gives you the medicine. Hopefully it makes your stomach feel better, but again, it's done nothing to address the malfunction. So your body's still breaking down, not working right. And what happens then? More malfunction. Let's say now you're going to get pains all over your body, neuropathies. You go to your doctor, you describe the pains. We have all kinds of things for aches and pains. We got Cymbalta, we got Lyrica, Neurontin. Give you the medication. Again, what you end up with is you're treating symptoms. All the patients come into my office, they're on 8, 9, 10 different drugs. No exaggeration. I mean, no wonder they're in a stupor. They got brain fog. It does nothing to treat the malfunction when you just treat symptoms with drugs. Now, some drugs are life-saving and necessary, and you have to take them, but oftentimes they're not. Here's the problem. In America today, the World Health Organization will tell you that America today has the very best acute care system in the world. If you're in an accident, you need a surgery, there's no place better to be than in a U.S. hospital. But those same statistics will tell you that we rank 38th in the world in health. And the reason for that is because we then treat all of our chronic conditions with an acute care model. We treat the symptoms. Don't get to the cause. If you're just covering the symptoms, it's like cutting the wires to a fire alarm. You know, there's a fire still going on, but you just don't hear the alarm. You can equate your body to a Swiss watch. If you open up one of these watches, you look, you see all these little gears in there, and it's amazing how they get all those gears in there and how the watch works and keeps time so well. Well, your body's like this, and it has all these different gears in it. You've got adrenals and digestion and liver detox in your brain, and all of them have to work right. If one gear goes bad, gets stuck, it affects the whole watch, so your whole body's affected. If 2 gears go down, you got a bigger problem. 3 gears, 4 gears, it gets to the point where it doesn't work right. It's a great analogy for how functioning your body works. All the gears in your body have to be functioning right for your body to work properly. How's my approach different? We find the root cause of your body malfunction. It's all about function. We don't care too much about your diagnosis as much as how the body is malfunctioning. If we can find what's wrong and fix that malfunction, your body will then heal itself and function properly. We want to reduce inflammation. We're going to heal the gut and detoxify the liver, combat that breakdown in the body's systems. And again, we're going to naturally support and restore function. And we use no drugs, nothing like that. Everything we use is natural. Homeopathics, minerals, vitamins, herbs. We'll use troches that you melt onto your tongue, sublingual liquids, vitamin tablets, capsules, that sort of thing. So what's the problem? The big problem is inflammation. Our bodies are on fire, and inflammation has lots of causes. It's like your house is on fire, and this fire alarm is going on. You don't want to just cut the wires. You want to put that fire out. And we have to identify what's on fire, put that fire out, and then rebuild the house. And that's how you correct function and get the body working right again. So most Americans do have inflammation in their system. And there's lots of different causes from the food you eat, and we'll cover that in just a minute. Your long-term effects of inflammation are going to be just what you're watching this video for. Acid reflux, chronic fatigue, brain fog, indigestion, weight gain. Okay, so let's talk about what causes inflammation. Digestive problems. The gut's not working right. There's something called leaky gut syndrome. A lot of people have leaky gut syndrome. What that means is that there's, like your gut should have a lining to it, kind of like the screen in a window. And if there's a hole in the screen, bugs can get in. Well, you can have holes in your gut lining, which let bugs in. And you need to fix that. You can have food sensitivities. Some people are sensitive to dairy, soy, different types of foods. Poor lifestyle choices, alcohol, lack of exercise, toxicity. We live in a toxic environment. I mean, all the chemicals in our foods and the herbicides and everything they spray, it's just bug spray and mosquitoes and whatnot. Infections, parasites. A lot of people have hidden infections and parasites in their system. In America, we don't think too much of parasites, but I have a lot of people come and they have parasites. You got animals in your house and such, or you eat sushi or sashimi, you could very well have parasites. Another one is heavy metal burden. A lot of people have heavy metal burden, and it causes chronic illness that just doesn't respond to even the medications. People are contaminated with aluminum, lead, mercury. And it's important to get that out of your system. Again, we do live in a toxic world. Farmed fish and canned foods and instant everything. So an important point here is that all chronic health conditions have common threads. So whether you have chronic fatigue, acid reflux, whatever, you're going to have metabolic imbalances, which are pretty classic, and neurological imbalances. On the metabolic side, you're going to have anemia, thyroid dysfunction, unstable blood sugars, your hormones can be imbalanced, food sensitivities, hypoxia, chronic inflammation. On the neurological side, you can have what's called decreased frequency of firing of the brain. Your brain can become fatigued. Your brain's controlling everything that's going on in your body all the time. And it can get tired. And what we find is that we'll run people through what's called a functional neurological exam, and we'll find that their left cerebellum may not be firing as hard as the right cerebellum. And when you do this, the brain is not spot on. And you want your brain to be spot on so that it can tell your body how to function, how your lungs to breathe, your feet to walk. I mean, everything goes to the brain. So to achieve this, we do proper testing. And that's what makes our office very different, is that we leave no stone unturned to find the exact cause of your problem. Have you ever been told that all of your lab tests are normal? I hear it a lot. The thing important to realize is that when you come in with a lab test result, those are what are called lab ranges. If you look at it, it'll say lab range. And you have to ask yourself, what does that mean? And I'll tell you, a lab range is an average. And what the labs do is they take an average of all the results that come in there and divide by the people that come in. So you have to ask yourself, who goes into those labs to have their blood tested? And the answer is sick people. People with cancer, diabetes, cirrhosis of the liver, all kinds of things. So this lab range is a range of sick people. And when someone tells you that your blood tests are normal, it's normal for the sick people that go down there. So in other words, it's not horrible, but it's just normal for the sick people. That doesn't make much sense to me, or to a lot of people. And in the functional medicine arena, the Endocrine Society went and said, that doesn't make sense. And so what they did, they went and tested healthy individuals and found that there are lab ranges and then there are functional ranges. And the functional ranges are the ranges that are present in healthy people. And so what we do is we take blood tests and we put them into our computer, and it spits out your results in functional ranges. So instead of comparing you to sick people, we compare you to healthy people. When you do that, you find all kinds of things that are not functioning right in the body that you support and fix, and the health comes back because the body knows how to heal itself. Here's an example of this. Thyroid stimulating hormone. Lab range, 0.45 to 4.5. Functional range, 1.8 to 3.0. So if your result came in here or here, you're told your test is normal. But if you're here, it may be normal for a sick person, but it's not normal for a healthy person. And what we would do is we address all these different situations where you kind of fall between the cracks between here and here. And every blood test has a functional range. So whether it's your red blood cells, your iron, whatever, all has functional ranges. So we do complete testing to determine your metabolic dysfunction. And it's important to do all these. We do a complete metabolic profile. So we do a complete thyroid panel. We look at your immune system. We look for anemia, liver panels, blood sugar, vitamin D, and kidney function. We also do something called an adrenal stress index test, which tests your cortisol levels over 12 hours. And so 4 times a day, you'll do this at home, where you use a saliva test that you'll put your saliva in this tube, and then we send it off, and it'll show us what your cortisol is doing. Cortisol is the stress hormone. In America today, most people are terribly stressed. Just our lifestyles are so. And if your cortisol is off, it's going to affect your blood sugar, it's going to affect your thyroid, a whole gamut of things in your body. We can also test you for food sensitivities. You can run tests for like dairy, soy, gluten, yeast, eggs. Digestive-wise, we can do stool tests and blood tests too that will show us whether you have a problem with heavy metals like aluminum, lead, mercury. You may have virus in your system, in your gut, bacteria, molds, infections, parasites. It's important to know this because those things will all cause inflammation in your system and cause your body to malfunction. So when we do a complete thyroid test, here's what we do. Most people come into our office with a thyroid problem and taking thyroid medication, and they're taking a level, we're seeing a TSH and a T4 level taken. And that's the only 2 tests they run. Well, there's really 12 tests. And by running all the tests, you're going to find out what's really causing the malfunction or function of your thyroid. There's a free T4. There's a free thyroxine index. There's a total T3 test, a free T3. Now, free T3 is very, very important because free T3 is the thyroid hormone that goes into the cell. Every cell in your body has a thyroid receptor, and free T3 is what goes into it. And I very rarely ever see someone come into my office where they've had free T3 tested. And if the free T3 is low, I mean, that's what it's all about. There's a 3T uptake. There's a TBG test that's run. And then we run what's called a TSH antibodies, which would show you whether you had an autoimmune problem with what's called Graves' disease. And then there's a TPO and a TBG antibody test that will tell you whether you have Hashimoto's. And lots of people have Hashimoto's and are totally unaware. They think they have a thyroid problem, but they really have an immune problem. And you address it totally differently. So how do we fix it? With functional neurology, we're going to balance the brain. We're going to balance that master computer. And we'll do that by doing our exam, determining if your right cerebellum is not functioning as strongly as the left, upper brain, lower brain, whatever it is. There are functional neurological therapies we do that will help balance that. One of the big things is we use cold lasers on that. Putting lasers to tissues rejuvenates them and puts energy back into the cells. Lifestyle changes. Eliminate inflammatory foods. Very important to do that. We got to put the fire out. We want to incorporate exercise. Most people are just too sedentary. Your body needs to move. If you want to be healthy, you need to be active and moving. Heal the gut and the liver. So important to heal the gut and heal the liver. To just change your diet and stop eating a certain food does not heal the gut. You've got to heal that gut. 70 to 80% of your immune system is housed in the gut. It's got to be healthy. Again, we talk about the cold lasers. Cold lasers are an amazing therapy. There's no side effects to lasers and these cold lasers. And hot lasers will cut tissues, but cold lasers don't do that. They put energy back into the cell. Each cell they found has a different type of a frequency. So there's a frequency for adrenals, for your liver, for gallbladder, for nerve cells, and we would use those in what you needed and what your body tells us your body needs. So with functional neurology, it's important. If you want your brain to work right, the metabolic part has to be right. If you've got blood sugar that's too low or too high, it's going to affect your brain. If you've got cortisol levels that are high or low, your body's got inflammation, fatty acid metabolism, all affect brain function. And it's obvious too, altered brain function is going to cause whole body malfunction. Has anyone ever tested your neurology to see if your brain is making you sick? A lot of times it's there. So now, based on your lab findings, this is what we may do. Remove inflammatory foods, and based on what we see, we're going to give you certain nutritional support to support your adrenal function, your brain, your digestion, liver, sugar, thyroid, and decrease inflammation. What conditions improve with this care? Whole list of them here. Chronic fatigue, acid reflux, brain fog, insomnia, blood sugar problems, back pains, plantar fasciitis. So you have to ask yourself, why do you want to do this? It's not as easy as just taking a pill to cover symptoms. And some people are content to just take a pill to cover symptoms. But you got to say, with what you've been doing, has it gotten to you where you want to be health-wise and life-wise? Are you ready to change? Because sometimes you just need to change to. If you keep doing what you've been doing, you're going to keep getting what you've got. We had a man come in our office, his name was Tom, who suffered from terrible neuropathy. He had pain in his hands and his feet so bad all the time, he just couldn't bear it. He couldn't sleep at night. He'd sit on the edge of his bed and just rub his hands on his thighs and rub his feet on the floor, trying to relieve them. He had been to all kinds of doctors. He'd been to Mayo Clinic, to Cleveland Clinic, been to all kinds of specialists. They recommended this, all the different medications. Nothing helped him. He came into my office and we did a full workup on him, and we found all kinds of problems wrong, all kinds of malfunctions. A lot of the different gears in his bodies were off. And I tell you, within a month, he was sleeping through the night. His life was changed, and he had not given up hope. And it's important not to give up hope, because a lot of people do. You've got to keep searching, and you got to be willing to change, though. And he'd admit that at the beginning it was kind of hard, because when you like eating certain food and you can't eat it, it's kind of hard to do. But wow, it's worth it to feel better. We see it day in and day out how this care helps people. Years ago, I had a gentleman come to my office, with back pain. He was 93 years old, and he comes walking in behind him is his 94-year-old wife. They'd been married 71 years. He accused her of robbing the cradle, but they're a cute couple. He was about 5'5" and walked in and had this bad back pain. I work on his back, and he says, "Hey, I feel better, Doc. Thanks a lot," and goes walking out the hallway. And so I follow him up to the front desk and said, "I'd like to follow up with you next week and make sure everything's okay." He says, "Can't do it." I said, "Why not?" He says, "Because I'm too busy." I said, "You're too busy? You're 93 years old." And she says, "He is too busy." And she whips up this book. She opens it up, and this is his day planner. I mean, every single hour for the next 2 weeks had something penciled into it. He says, "Doc, on Friday mornings, I go down to the senior center to visit the old folks." And I thought, this guy's my hero. He's 93 years old, no cane, no walker. He's up about living life to the fullest. And there's this 94-year-old wife right behind him. And what a team they were. It's just so awesome. But the human body is an amazing creation that's designed to last a long time. You do not need to slowly get old. People think they're getting old and they just keep on doing what they're doing. You can change this. The body is an amazing creation. Here's an exercise for you. You can do this now. You can pause the tape. The video. Take a pencil and paper and go ahead and think seriously about these 3 questions. Where are you health-wise right now? Is this where you want to be? If you change nothing, where are you going to be in 5 years, 10 years? And then ask yourself, what do you want your future to look like? Because you can go by and you can see these nursing homes with people in wheelchairs, just sitting in their chair, watching TV, doing nothing. Their body's broken down, it's not functioning right. Or you can do something to keep your health with you and to make your life better in the future. I want to bust some myths. These are 3 myths that I hear from people that I just get tired of hearing them. I think I'm too old to get better. I have 60-year-olds come and tell me they're too old to get better. Then I got 90-year-olds that think they're too young to hurt. And the truth is, you're never too old to get better. The body, if you got life in your body, it has a great propensity to heal. So don't sell yourself short. You're never too old to get better. It's genetic. My grandfather had diabetes. My mother has it. I got it. Well, you can inherit lifestyles too. Food abuses and different things. So to blame it on genetics sometimes is a cop-out. It's really important to realize there's a field of study now called epigenetics, where they find that different foods and different nutrients and things you do can actually calm down the effects of a genetic fault too. So you don't necessarily need to be so sick with it. Learn to live with it. I hate this advice. A lot of people get it from their doctors or whoever. Don't worry, I got that. You'll never get rid of it. Just learn to live with it. That's giving up, and life is too short just to give up. People ask us about affordability. To answer the question on cost in this care, there's no cookie-cutter approach to this. Everybody's different. You may have 1 gear in your system that's wrong. You may have 10. Somebody that has just a mild problem may improve in just 30 days. Someone that's got really severe problems, it can take them 9 months, 12 months to fully heal. That being said, most people feel better. Within 30 to 60 days, they're feeling a lot better, and they know they're on the right track. As far as costs go, you can afford this care. If you want your body to be better and to be healthy, you can afford to get the care. Very few people can afford it. We have financing options available at the office. If you can afford $50 to $150 a month, you can afford this care. It's important to note that insurance does not cover this type of care. This care is not usual and customary. If you look at your insurance, it will tell you we cover usual and customary. And this is not new. We've been doing this for years and years and years, but they don't consider it usual and customary. They do not cover this type of care. Functional medicine is becoming much more popular. There are divisions of integrative medicine and functional medicine at Mayo Clinic, Shands Hospital in Gainesville, and the Cleveland Clinic. Dr. Oz, I'm sure you've all seen on TV, he's always got functional medicine doctors on there, and just more and more people are aware of it and gaining interest in it. So what do you expect from a visit here? Your first visit, you come in for a consultation, and we'll discuss your problems, what's going on in your body, and where you want to go with this. We'll review any current blood tests you have once we put them into functional ranges, and we'll be able to show you what you're looking like compared to healthy people. We have different questionnaires that you'd fill out too, and we look at these and determine whether we thought you were a good candidate for care. If we think you are, we then recommend you have a functional neurological evaluation, and we go through the functional neurological exam. At that point, we dismiss you from that visit, and we'd reschedule you to come back in again. When you come back in again, we'll tell you whether we're going to accept your case. We'll only take your case if we think we can get you better. Better than 95% of the people that we have come into our office have excellent results. On that second visit, we'll give an overview if there's any other further testing you need to have done. We'll review your exam findings, and then we'll talk all about your financial responsibility, what the costs of care are. So again, you won't incur any expense like that until you know exactly what we're dealing with and what the treatment options are. So start living today. Give us a call and find out what's wrong with your system. Remember, you don't just have to live with it.